So looking at a bit more detail at Healthy Lives, Brighter Futures, which I'll just stress, it's really looking at England rather than the UK, because if you're aware of anything that's going on in the other countries, particularly Scotland, they have their own policy papers, and the structure and the way that children's services is set up is quite different from country to country. So Healthy Lives, Brighter Futures actually divides age groups into three. It looks at the 0 to 5 age group, it looks at the school age group, and it looks at the older teen age group. And some of the key objectives within this is that we really need to have a public health focus and look at reducing health inequalities. So, for example, the importance of reducing inequalities in infant mortality, the importance of ongoing work in reducing teenage pregnancy, and results so far are positive, but we need to continue to do that. To continue to increase breastfeeding rates and reduce obesity, reduce things like the experience of bullying in school, because in the past we focused too much on physical outcomes, haven't we? And things like the CAMS service has been a bit of a Cinderella service. So it's really important that we look at mental health and emotional well-being. So I think that's a really important target, to reduce the experience of bullying. Reduce hospital admissions for children's injuries, reduce preventable child death, and improve child and adolescent mental health service and services for disabled children. And I think that last target, as I said about CAMS, I think both of those services have tended to be overlooked in the past. So what the policy document says is that we can't affect children's health outcomes unless we work with parents. And I think there's a lot more focus now on the importance of working both with children and parents. And in the future, we're going to have Health Watch, which is really going to allow the voice of clients and patients to be heard and to be, to be taken on board. What's important with this paper is that they say we shouldn't just target resources on those with the most needs, which is very important, but we must maintain a universal service. And you may be aware there's been a big debate about that. For example, should health visitors visit all families with new babies, or should it only be those where there are needs? Well, I really don't see the logic in not providing a universal service, because how can you assess the needs unless you actually make personal contact with people? And it's not a static concept, vulnerability. People move in and out of vulnerability. So I think it's very important that universal services are maintained. So they're saying it should be a kind of graded service that children's workers provide. It should be universal, targeted, and then specialist support. And as I said, it's three areas that this paper looks at. So looking in the early years, we need to develop the health visitor workforce to deliver the Healthy Child programme. And you're probably aware of the implementation plan. We're in the middle of this project. It's time limited to 2015. I think it's a little bit worrying because the projects that have been set in place, there doesn't seem to be any kind of long-term plan for how these programmes are going to be sustained. And you'll find that a lot of the plans for children's services are actually from now to 2015. So, as with all governments, there's an inability to have a really long-term view. And of course, our focus is the Healthy Child programme, the 0 to 5 and the 5 to 19 Healthy Child programme. And as you're, I'm sure, aware, there's a key programme set for looking at children at 2 years of age. And we need to improve and develop the new antenatal and preparation for parenthood programme. Now, I don't know about your areas where you work. I think there's a will to have children's workers working much more in the antenatal period, but I'm not seeing that happening on the ground. I hope that that will be realised in the future, because it's so important that children's workers, if we're going to ensure that we provide an early intervention and a preventative service, we need to be there really, really early. So the aim is there, but I don't think it's being realised at the moment. But there is the potential and the opportunity for that to happen. There's recommendation that we expand the family nurse partnership scheme. The evaluations from the pilots are really positive, and I think that's excellent, because resources have really been ploughed into that, and people that are working in the family nurse partnership programmes have quite small caseloads. I think it's something like 25 to 50 families working very intensively with those that are eligible from early in pregnancy up to the age of 2 years. And the importance of strengthening the role of the Sure Start children's centres. And one thing that I think is really important, as local authorities take on the responsibility for public health, and their budgets are really being cut and squeezed, that they don't look to the children's centres to cut the services there. Where I work 4 days a week, I work in Camden, and they're maintaining all the children's centres except one that they've closed. But one which is very worrying, they are restricting some of the services. They're no longer universal. And I'm sure you've got your own stories to tell about children's centres as well. So moving on to school-aged children, it's important that we improve the Healthy Child programme for school-aged children as well as the 0 to 5s, that we strengthen the National Healthy School programme. And as schools become academies and as they develop, I think they are maintaining a focus on maintaining their healthy school status. We need to look at creating a world-class system of PE and sport. So there's an acknowledgement that exercise is very important for children. And not only during the school day, but looking at how do children get to school and how do they get home. And these walking buses, I think that's a really good idea. So instilling the importance of exercise, getting children away from sitting at computers for long periods of time. And of course, improving the quality of the PSHE programmes. And finally, with the Healthy Lives, Brighter Future paper, looking at committing to offering the older teenagers 3 hours high-quality sport a week. Now, I think it's very important, and it's really good, that the government aren't forgetting the needs of older teenagers. We've had a lot of focus on the early years, but this is a key time for young people, and I always get slightly despairing with safeguarding when people feel that they can't do much for children when they're 16 because they're just going to drop out of the system and they're young adults. But there's a huge amount that we should do to try and help young people. I think particularly helping them to get employment. I just think it's, we're all faced with this high unemployment level, but for young people who are coming out of education, we really do need to see them being able to get work. And the development of your welcome standards, so young people know the services that they can access which are young people friendly. And the development of sexual health services. And I think we're seeing that, particularly with the opportunity to use IT and text message young people, remind them about appointments and the importance of accessing sexual health services. So we need to make sure that we acknowledge and we face the challenges for the future. And with all these different commissioners and providers, we need to make sure there isn't further fragmentation, that we actually do an about turn, we try and integrate the services. We look at the child's journey and we look at the pathways of care that we provide, not just look at it from a task-focused perspective. And it's very important that we look at what resources there are. For example, the School Nurse Development Programme has been in the news recently with the publication of Getting It Right for Children, Young People and Families. and all the opportunities that they see that children have for accessing their school nurse, well, it's not going to happen unless there are more school nurses. I'm absolutely convinced of that. And I work quite closely with school nurses in Camden. And really, all they can do at the moment is go to core groups, review conferences, initial conferences, do termly health reviews for children who are on child protection plans and child in need plans, complete the immunisation schedules. But what we need to do is do this early intervention work. Children need to know who their school nurse is. And unless the resources are there, it's not going to happen. And although it's really good that we have the health visitor implementation plan, we don't want all resources channeled into health visiting at the loss of other people in the children's work. And it's good that people can look at their career and progress, but if community staff nurses decide to go into a health visitor training course, then obviously we need more children's staff nurses, don't we? So we can't compromise on resources.